Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. Today I will discuss my paper, a review on exercise and asthma. As per introduction, asthma is a common chronic respiratory disease that characterized by inflammation of the airways and can severely impact breathing. Symptoms of the asthma are various, including shortness of breath, wheezing, coughing, and also tightness of chest. Globally, an estimated of 262 million people in 2019 suffered from asthma and caused 455,000 deaths. In Malaysia, overall, 6.4 Malaysians were formally diagnosed by doctors to having asthma. And comparing between ethnic groups, Chinese population has the least percentage of having asthma, is only 4% compared to Malay, Indian, and other Bumiputra with 7.2, 7.6, and 7.8 respectively. Now is the exercise recommendation for the heart failure patients. Based on the American College of Sport Medicine ACSM 2018, we comprise of aerobic, resistance, and also flexibility exercise. For aerobic exercise, asthma patients should perform 3 to 5 days per week with intensity of moderate, which is 40 to 59% of the heart rate reserve or VO2R. And then for the time is progressively increased to at least 30 to 40 minutes per day, and they can use any exercise that use large muscle group. For the resistance training, frequency should perform 2 to 3 non-consecutive days per week and begins at 60 to 70% of one repetition maximum for the beginner. For the time, 2 to 4 sets of 8 to 12 repetitions focus on the major muscle groups. For endurance, use less than 50% of the one repetition maximum. And for the time, you can use variety of body weight exercise, free weight or machine weights. For the flexibility, basically we should perform more than 2 to 3 days per week, and it is recommended during cool down and need to stretch to the point of experiencing tightness or slight discomfort. Usually you need to stretch 10 to 30 seconds hold for static stretching and then do for 2 to 4 repetitions. And you can form static, dynamic or PNF stretching. Another exercise can be done by asthmatic patient is aerobic exercise based on Dogra et al. 2011. Just from perform 3 days per week for 12 weeks and another 5 days per week for 12 weeks. And then for the intensity, use 70 to 85% of heart rate maximum. But in this study, duration is not stated, usually around 30 to 45 minutes or to 1 hour. And then based on patient preference, they can choose whether outdoor jogging, treadmill, recumbent bike, or upright cycling, elliptical, or rowing machines. And also it combined with the resistance exercise, one set per week of strength exercise targeting the major muscle groups, which are chest, back, shoulder, tricep, bicep, quadricep, hamstring, and also abdominal. Another study from Jakula et al. 2018. It's combined exercise between aerobic exercise, muscle training, and also stretching exercise. Aerobic exercise performed at least 3 times per week, at least 30 minutes duration. And it is a suggested form of exercise including rapid walking, jogging, running, Nordic walking, skiing, cycling, dancing, exercising in the gym using, for example, weights, rowing machine, or cross trainer, and should be performed 70 to 80% of heart rate maximum. Include also muscle training, just perform twice a week to strengthen abdominal, back, upper body, and also thigh muscle. And stretching exercise should be performed before and after aerobic, and also strength training exercise. How mechanism of exercise improving asthma? So by doing exercise, basically we are improving our cardiorespiratory fitness and also increase oxygen uptake capacity. So it will increase threshold for breathlessness, and with that, people with asthma can cope everyday life with lower level of effortness. Next, by doing exercise also, there will be a reduction in bronchial hyperresponsiveness (BHR) and also interleukin 6 plus monocyte chemoattractant MCP1. This will cause reduction of sputum eosinophils and also fractional exhale nitric oxide FeNO. And this FeNO basically will reduce airway inflammation, so our breathing will get better. Other than that, exercise also will also benefit effect on airway smooth muscle. And then this consistent with the idea from the SSM. By doing exercise, basically we are build up tolerance to physical activity over time. So here are basically the limitation and also exercise related risk for asthmatic patients. The most worrying one is actually exercise-induced bronchoconstriction, EIB. Basically, high intensity exercise and also prolonged exercisation duration can induce bronchoconstriction in susceptible individuals. It also can be worsened by the presence of series of environmental factors such as air pollution surrounded with dry or cold air, allergens, and chlorine in swimming pools. So what we need to do? So to prevent this EIB, pharmacological approach need to be administered by using short-acting bronchodilators before and also after the exercise. For those who experience asthma exacerbation, they are advised to not doing any exercise until their symptoms are well controlled. So innovative exercise approach, we have breathing retraining technique. Basically, we divide this into three types of different goals in manipulating the first one, the pattern of breathing, which is to breathing retraining and also improve the strength and endurance of the respiratory muscle, improve while we are doing respiratory muscle training and also increase the flexibility of thoracic cage and improving posture by doing a musculoskeletal training. The rationale of introducing this exercise is based on presumption of asthmatic people have dysfunction and also abnormal breathing patterns. Other things we can do is HIIT. It is a 12 weeks program. We can perform twice per week. The overall session is 40 minutes, spread into 5 minutes warm up, 30 minutes exercise, and 5 minutes cool down. Modality used is cycle ergometer, and exercise bulk basically started with 80% of the maximum work capacity and can increase until 140% of maximum work capacity. So the author suggests that HIIT is another option of exercise training for person with asthma who can safely tolerate high intensity of exercise and may benefit from this modality. As for conclusion, exercise is important to be practiced as it helps to improve lung capacity, improves cardiorespiratory, and also reduce physical deconditioning. Some exercise have improved their efficacy in reduce incident of exacerbation and delay the risk of develop other chronic disease. However, some exercise may not recommend to be practiced due to certain limitation to the lung and it might worsen and provoke the asthma symptom. It is important to focus on light to moderate intensity of exercise, warm up before and cool down after exercise, identify and alert with any exercise-induced asthma trigger, make sure you use pre-medication properly before study exercise and always seek for advice and help from healthcare provider in order to provide patients with the confidence for exercise and lead very good quality of life.